I want to get going because we have a very special guest and I want to make sure we don't use too much of his time. But first of all, I just wanted to say welcome to everybody. I think we're over day 60 in our quarantine, but this I think is probably our 7th week of webinars. So I wanted to thank everyone again for coming on and joining. And even if you take away just a little something every week, I think it's really nice to connect to everybody. And I just also want to say I hope everyone had a really great Mother's Day, and that some of this sunshine is starting to inspire you like it is me. And I am especially happy today because we have a really wonderful guest joining us, someone that I admire very, very much. It's Rep Santiago, which I'm sure all of you know because you came on board to listen to him. And so I'm just gonna take you a little bit through today so you know what's gonna happen in the next half an hour. And if I can move my screen. And so just to give you a quick overview, Rep Santiago has been a wonderful representative at the State House for us from the 9th Suffolk District, and also on our Committee for Public Health and Healthcare Finance. So we really rely on him. And most of you know that I run the Operation House Call program, and out of that stemmed a couple of bills. So we've been able to work with him on those bills as well. Of course, everything is a little bit stalled right now, a lot stalled, but we're hoping to get back to that. So today we'll also go over those really important focus groups that we held last week. And actually we're just gonna touch on one of the groups because we didn't get to all of the analysis of the results. I'll give you a state update, and some of those things might get covered by Rep Santiago. And then a really important quick federal update at the end as well. So before I turn it over to John, I just wanted to make sure you saw some of the things that he's been doing as our frontline emergency medicine MD at All Places Boston Medical Center, which has really seen seen the worst of this crisis. And if you don't follow him on Twitter and Facebook. He gives wonderful updates from Beacon Hill and from the front lines. And one of the most important things that he's worked on from our perspective that really affects the disability community has been our crisis standards of care document. And I'll let him fill you in on all of that. But do you want to take it away, Rep? Do we need to unmute?
Can you hear me?
Yes, we can hear you. Yep.
Awesome. Well, good morning, everyone. It's so good to be with each and every one of you. I'm actually going to be heading out in about an hour, so I'm going to be enjoying some sun, hopefully, and getting a little break from the house, which we've all been quarantining. Well, thank you, Maura, for the invitation. When you reached out to us and my staff, I mean, we obviously said yes. I mean, all the work you do is tremendous, and the ARC and what you guys stand for as an organization, it's to be applauded. And we thank you not just for the work you do, but just for the values that you stand for, and for really being a voice for the disability community. And I mean, you've taught me a lot about this. I think the great thing about being a legislator is that you get to sit down and all these people get to come talk to you and educate you on whatever the topic is of the day. And if you're curious, like many of you are, and I'm a pretty curious guy, you get lost on these little rabbit trails and learn a lot about a whole bunch of different issues. So thank you, and thank you for being active on the COVID-19 space as well when it comes to crisis standards of care, something that I care very much about. And we've been vocal, and we were a little bit active in getting some revisions to take place. So I think what I'll do is I'll speak for 10 minutes or so and give you just some updates and what I'm seeing in my 2 roles. And so for those of you again who don't know me, it's Jon Santiago. I've been in the legislature for I guess almost 2 years. Wow. And it's been an interesting and fun, and I think a productive 2 years. And we're running for re-election, and I think we're unopposed, so I think we'll be there for the next 2 years. You're stuck with me for 2 more years. But I also happen to work as an emergency room physician at Boston Medical Center. And for those of you who don't know Boston Medical Center, it's the big safety net hospital in Boston. It's actually the busiest emergency room in New England. and the biggest one in terms of caring for underserved communities. It's a place I've wanted to work at since I was a kid, actually. I'm Puerto Rican. I grew up in parts of Roxbury, and I think, caring for underserved communities is something that I care very much about. And the reason why I ran for office is because I wanted to do something about it, because although I love the emergency room and the excitement that comes with that, and it's a pretty exciting place at BMC, it's heart attacks, strokes, it's like the movies. What's happening there is a direct reflection of what's not happening in the State House, right? And what's happening in their communities. And so I thought if I could affect this by running for office, then I would do that. So we've been there for 2 years. I actually will be at BMC for 5 years now. But over the course of these past 3 months, I think we've been on quarantine for almost 2 months now. It's insane. I've been working at Boston Medical Center. And when I ran for office, I remained committed to working at the ER because I thought one job informs the other. If I'm able to take and uplift the stories of my patients and constituents to the State House, I think it'd be a win-win. And so I kept the job, and I typically would work every other weekend. Just to give you an idea, a full-time ER doctor works like 3 or 4 days a week, 8-hour shifts, because it's a pretty intense kind of, work environment. So I worked every other weekend, typically a Friday, Saturday, and Sunday, so 2 weekends a month. But when COVID-19 hit, given the surge and just the fact that we had to scale up resources and staffing, I decided to help out. And I was young, relatively healthy, not like some other people who physicians, they have underlying lung disease as well. Some of them are elderly and they didn't feel comfortable working. So I said, you know what, I'm going to work. And so I've been working Friday, Saturday, and Sunday for the past, 8 weeks, it sounds like, overnight shifts primarily. And so I pretty much work Friday 11 to 7 and do that Saturday and Sunday. And then I flip gears, and then we're like in the State House and taking care of constituency stuff during the week. And in that 8 weeks or 7 weeks of working, it's been an honor and a privilege, but it's been fascinating to watch how we've transitioned. I remember coming in the first couple of weeks, and no one, quite frankly, had any idea what the hell to expect. They knew things would be bad, and when it came to testing or when it came to PPE, and this is even at a large academic medical center with significant amount of resources. I can't even imagine thinking about some of the community health centers, some of the smaller hospitals, some of the nursing homes, and that's why we're having such a bad outbreak in these nursing homes, where they account for 60% of the deaths now across the Commonwealth. But over the 7 or 8 weeks there, it's been fascinating to watch how we've developed. I remember coming in early on, and no one had any idea what to do. I mean, we thought this was like the flu, which it kind of is in some respects, but in terms of its transmission and where we would care for these people and which rooms we would put them in. And so I remember coming in on a Friday, Saturday, Sunday, and every shift, like having to come up with a plan with the nurses. Like, okay, if the ambulance comes with someone, I guess we'll put them in that room. I guess we'll do this. I guess we'll try to test them. And initially, you couldn't test everyone. You had to call DPH to test somebody. Now that sounds outrageous. Here you are, you go to medical school, you go to residency, here you are, you're a full-fledged doctor, and you have to call some bureaucrat over the phone to test. So with the narrow testing guidelines and the fact that there weren't enough tests, it was difficult. And you want to test everyone, but you couldn't. But over the course of the past 7 weeks, we've been able to scale up testing and get tests in a more rapid result. So right now I could test you and find out in a couple hours whether you have it. Versus the first week, we'd send the test all the way to Utah, and it would take 5 to 7 days. Sometimes the test would get lost, and it was just a complete disaster. And so now, and I remember testing initially, it was like one in the nose, one in the mouth, completely uncomfortable. Now it's just one swab in the nose. And so we've come a long way with respect to testing, and we still have a lot more to go, make no mistake. Although we are a leader in the states with respect to testing in Massachusetts, we still have a lot more to do if you want to get to a place where we can open the economy, and everyone can feel safe. And so the testing, that's a little bit about the testing. With respect to the PPE, it's been a big issue. As I'm sure many of you are aware, it's not just a mask, it's a special type of mask. It's it's a face mask as well. It's gear as well. And just this past week, it looks like we almost ran out of the disposable yellow gowns that we would wear. Now we're wearing these reusable ones. And this is at like a level 1 trauma center, right? And I'm not sure what's happening, but I feel, and I've always felt that at Boston Medical Center, I can get the PPE that I need. But again, I don't know that's the case across the Commonwealth, whether that's in certain homes, group homes, in community health centers. And so, I'm fortunate to be working at a place where we have the PPE and, and the resources that we need. With respect to what we're seeing at the hospital, we're actually starting to see a decline in the number of patients with COVID-19. Right now at BMC, there's about 120 patients admitted with COVID-19, and that's about a third of the beds. Up until mid-April, it was like 200 and something. The vast majority of the hospital was COVID-19. Right now we have about 30 something patients in the ICU. That's down from, I think almost 100, and that still takes up about half the ICU. But again, these are very sick patients. And from a clinical perspective, as a physician, it was very challenging because you would see patients who, for the most part, were asymptomatic, but then you would see patients who are relatively healthy get very sick and, and die, unfortunately. And I've seen the whole spectrum. And it's been challenging because there are no visitors in the hospital. And so you have to have these conversations with these people with no family present. And sometimes you can't have the conversation because, they need to be on a ventilator or breathing machine. So it was very challenging. And it was emotionally draining. And, the ventilator issue was another one. We thought we were going to run out of ventilators. And initially there was a push to ventilate people early on. And I don't think the public was aware how significant, how serious ventilating patients is. The idea of putting a tube down someone's mouth, breathing tube, is a very dangerous procedure. And you expose them to pneumonias and all kinds of infections. And so it's a dangerous one. But over the course of the next couple of weeks, things were evolving. And now we're at a place where we want to stave off intubation, and we could do all kinds of things that we never used to do. For example, like prone people, put them on their belly to kind of, help their lungs, which is, we've never done this before in the emergency room, not many times in the ICU as well, but now we're doing it in the emergency room and seeing a lot of success. And so from a clinical perspective, we're getting to a better place. We're trying out new drugs. Hydroxychloroquine looks like, despite all of what Trump was saying, it really didn't do much. Studies are ongoing. Remdesivir, this new drug that's out, looks like there is some benefit with respect to decreasing hospitalization, but more to see. Another issue, I think, with the tweet that you're showing right now, I was concerned because some hospitals were getting the donated remdesivir and some were not. And again, we're talking about equity. And to me, when some hospitals are not, that raises questions of accountability of the sort. And so when I'm not in the ED, I go to the State House. And again, it's about really uplifting the voices of my patients and of my constituents when I'm there. And I've been honored to serve on the COVID-19 task force in the House of Representatives. So that's 5 people. And we've been really tasked with how the House continues to operate. And so, we came up with a system to vote remotely over the past couple of weeks, led by Rep. Driscoll and Rep. Hogan. And that was pretty awesome. 400 years, the longest continuously used constitution in the whole world. And here we are now voting remotely. So it was an honor to be a part of that and to really raise some of the issues that I was seeing on the ground with respect to communities of color and vulnerable communities and homeless communities, right? And so one of the issues was standards of care, right? We knew this was going to come up. We saw what was going on in Italy. And so the governor put together essentially a task force, and there wasn't, in my opinion, much diversity on the task force, with respect to race, class, if you were disabled or not. It was just a whole bunch of doctors, kind of the same old characters. And so when they came out, it was concerning to a lot of people. And I think I got on a phone call with a number of doctors and advocates and said, you know what, we need to push for more equity in this. And we were able to, with the help of folks like yourself and other advocates and the physician community, I said, listen, I spoke to the speaker and I said, we should do something. And to his credit, the speaker said something pretty quickly. And not only did he do that, but he said, we need to collect data on race and ethnicity, and we need to establish a task force. So pretty quickly, we were able to establish and pass a law in the House of Representatives, which I think is being visited by the Senate right now. And so, that was an awesome example of how we really take what we're seeing on the ground and amplify those voices in the State House. And so, it was an honor to be a part of that. And now we're at a phase where we're on this this quick surge, this plateau that feels like forever. And I don't know how long it's going to last. I think May 18th is around the corner, obviously. And it's concerning to me that the number of positives is still pretty high. And so I don't know if exactly we're ready to open the economy. And open the economy, for what that means, we don't know. Obviously it would be irresponsible to open all the economy. because there's a concern that there's a second surge that could come. And if you're paying attention to the news, even in these countries like South Korea, Germany, that have done a good job, they're seeing outbreaks and spikes now. And so it's concerning that we, nowhere near the testing and what they've been able to do, are about to open the economy. And so we have to be very careful, because the second surge could be worse, because we've done social distancing so well that estimates say that about 70% of us haven't been exposed to the virus. And so if we just unleash it, go out there and expose ourselves to the virus, not only could this result in a surge, but this can coincide with the flu, the seasonal flu, and result in a situation where here we are in another surge where hospitals are at capacity. And so, I'm still in the State House fighting and advocating for a whole host of issues. Today I'll be testifying on a bill to vote by mail and to expand early voting, given what we're seeing on the ground with COVID-19. So still active, still around and about, and I'm happy to pause there and take any questions.
Wow. Okay, we'll just go to verbal questions if Carrie, you want to unmute. Or Carrie.
Oh, sorry.
There we go. So thank you so much. I mean, wow, just amazing work. So thank you for everything you do in both the hospital and at the State House. I'll keep it quick. So my two questions are this. One, how close are we, just as far as accessibility for children, people with disabilities, elderly, etc., to getting that test where you put the spit in the vial? And then my second question is, if we do go through that second surge, what are the talks right now as far as what the new hospital locations will be? Will it be more tents, more field hospitals, or what are those discussions? Thank you.
Yeah, so thanks, Carrie. So your first question, there are so many different types of tests right now. It's kind of all over the place, right? The FDA has fast-tracked so many tests, it's tough to tell. I mean, in the White House, they're using these 15-minute tests. We at BMC, over this past month, we have access to the rapid test now that come back in a couple of hours that help us, able to disposition patients, like whether to admit them to the hospital or to check a homeless person who doesn't have symptoms. Because a big part of this is a lot of people are asymptomatic, right?
Right.
From 30 to 40 to 50% of people are asymptomatic. And so what is that, how do we kind of determine like who's safe to go outside, who's been infected? And that's if we believe that infection confers some sort of immunity, right?
Right.
But ultimately, to get over this COVID-19 chaos, we're going to have to get to a place where we have herd immunity, right? The idea where enough people are immunized or protected, where transmission is halted. And you can only get there with a vaccine, which we're nowhere near of, although there's like, anywhere from like, I think I read like 100 vaccine trials. Or you can get infected, assuming that it confers some sort of immunity, and we're not there. So in lieu of that, we have to test like crazy and contact trace like crazy. And that's what we're doing right now. And so what we're seeing are efforts to increase testing across Boston, at least where I'm at, particularly in communities of color. I think we've opened up to 20 sites in like more vulnerable communities, and we've also started some antibody testing as well, which gives you an idea of who's been infected or not. With respect to your second question, I think the hospitals are very aware of the concern that this could result in a second spike, and our capacity is still there. And my hope is that if we have to go to that, we'll be able to react quicker because we've been through it before. But I'll also say that staffing is still pretty high. And another interesting fact about this is that during the epidemic, the actual volume in the emergency room actually went down by 40 to 50%. And so, I work in a pretty fast-paced environment where it's kind of crazy. Everyone's sweating and running around, and like, it's like gunshot, heart attack, boom, boom, boom. And over the course of the epidemic, volume had significantly decreased. So not a lot of patients were coming in, but sick patients were coming in. It got to the point where there was a concern that so many people were scared to come to the hospital, particularly vulnerable communities, that they wouldn't come. So they'd only come when they get sicker, right? When the heart attack eventually, came to a head, when the stroke started showing some deficits. And so there were some PSAs to say people should come to the hospital. And now we're starting to see an uptick in our cases of the regular patients, like the heart attack, strokes, diabetes, the urinary tract infections, and like, and people have suprapubic catheters and that sort of thing. And so, we're all aware of that, and staffing is just going to keep up until, we're in the clear.
Sure. One last quick question. Sorry to hog things here, but I'm sure this is important to everyone. Have you seen any fallout or any issues around helping individuals with disabilities that sort of ended up with having to deal with, you know, mental health or restraint or things like that? Like how has that been looking in the hospital to you?
You know, with respect to like restraining or mental, not really. I mean, I do have a concern for like, you know, people who live in group homes. And just the fact that the CNAs and the visiting nurses going to see them, I mean, they're literally potentially transmitting virus, you know,
Right.
people to people in nursing homes. And I mean, to me, that's what gets me most nervous, given the fact that so many of these people could be asymptomatic. And if they're asymptomatic, but at the same time, they have underlying health issues as well, right? You know, and you know, maybe they can't communicate their symptoms as well. And so, but on my end, you know, I tend to, you know, as an emergency room doctor, I always think like, you know, worst case scenario. And so, you know, when someone comes in, you know, I just presume that they have the virus or think worst case scenario and just, you know, just make sure that we're doing the best we can and looking at every option to provide the best care we can.
Thank you.
Thank you.
Yep.
Carrie, are there more people with their hands up? I can't see the chat either.
Yeah, Jossie, would you like to?
Yeah,
You're
sure.
unmuted, so I know you wanted to talk.
Well, actually, just one thing, you know, in terms of testing, I had actually signed up. A laboratory in my town, Bedford, was collaborating with a local church to do testing, and I had signed up for testing for it last Tuesday, but it was postponed because they're running low on swabs. So I don't know if that seems to be a thing, because I wasn't sure if I should even get tested because I'm asymptomatic and I really don't deal with people. But I figure that I can help with you know, if I am positive, you would know, or if I'm not. But I guess my question is May 18th seems to be a date that the governor is considering beginning to open the economy, but it seems to me he's not in a rush. And I'm just wondering, what do you think is going to happen, or what should happen? I mean, do you think we're ready for May 18th to start, or because it seems like the governor would listen to you, because it doesn't seem like he wants to go too fast. He wants to be cautious. So I was wondering, what do you think about May 18th?
Well, thank you for your question, and I hope you're well in Bedford. My aunt lives in Bedford with my cousin, so I've been there a time or two. So May 18th is, you know, it's 4 days away, you know, and I think it's all really subjective right now. As you know, the governor came out last week, kind of this sketch of what's going on, very you know, superficial outline with a lot of questions, and it almost like made it worse because everyone's like, you know, what does that mean? You know, what types of businesses are you going to open? So it very well could be May 18th comes, you know, they drop a plan, but the first phase is very, very restricted. You know what I mean? It all depends on what the first phase is going to look like, which we don't know yet, right? If that means open up, you know, restaurants and cafes, that sort of thing, that might raise a significant red flag to me. But if it means like, you know, we're holding on that and we're limiting, you know, the economy, I mean, it could be okay. We just don't know until May 18th comes. I do think, you know, there's a lot of pressure coming from the business community to open things up, and it's understandable. And it's not just big business. It's, you know, I've been involved in a lot of sobering conversations as an emergency room doctor. And one of the most sobering conversations I've had this season has been with small businesses, and listening to people talk about what's going on in their, you know, they spent their whole life working for a community, a product that they believe in. And all of a sudden, even in good years where margins were quite low, that, you know, in this, you know, horrendous economic, you know, environment, that things could completely disappear. And so it's about weighing the benefits, the pros and cons, but we have to really prioritize the public health right now.
Okay, thank you, Representative. Beth had a comment and a question. Do we know whether hospitals are allowing people with intellectual disabilities who are admitted for COVID-19 to be accompanied by family members or direct support professionals?
Yeah, that's a great question. You'll have to contact the individual hospital. You know, it's funny. Early on in the pandemic, I want to say the first couple of weeks, I had a young man with this. He was disabled. I think it's like, you know, a severe case of autism, and he was maybe 23 or so, and he came into the emergency room, and we actually brought his mom in and admitted him with the mom and everything. And so I think it was a case by case basis. But I think that's something that people would be, doctors, nurses, and hospital administrators would be, okay with. I would hope at least, right? I mean, again, certain patients, I mean, a number of what I call red flags, things that, make me think that I can't get a full history from someone who can't communicate, right? I need to be super careful. I need to find additional documentation or to speak to a mother or a family member, whoever can help with that. And these people are scared, they're all in their room by themselves. And so, I was able to admit them to the pediatric, floor with their mother.
Great, thank you. Good to know. And Jean had a question. Do you recommend retesting of individuals who initially tested positive to ensure a negative result before ending isolation?
The data, again, the difficult part about this is that everything's evolving. And I think for physicians who are so analytical, who like the data just to all be there, we don't have any of that. And I think some of the initial studies that came out of China were showing that they were testing them after they were, infected, improved, were asymptomatic, and they kept on having positive tests. Or I've had friends that had positive tests, negative tests, positive tests. It's all over the place. I mean, these tests are not perfect. So what I would tell people is that, listen, if you've been tested and it's positive, if you quarantine and you do what you're supposed to do, it's probably okay. There's probably no need to go take up another test that someone could use. I mean, early on in the epidemic, people would come to the hospital, fairly asymptomatic. And I would say, listen, I'd love to test you, but given the fact that there aren't a lot of tests right now, let's just assume that you're positive and let's quarantine, Now I would test them if they had, if they had someone at home, for example, who was an elderly person who was, or someone who had underlying lung disease at home, or if they were an essential worker, right? And I would test them. But for the healthy person who's, largely asymptomatic, who's okay. And again, the vast majority of people who have COVID-19 do well. It's just, a bad flu. That there's probably no need to get another test.
Yeah. So Jean did comment that she was really speaking about group home populations.
Oh, yeah. So congregate living situation is a different ballgame. Whether it's a nursing home or group home, it's like they should be doing probably recurring testing just to make sure that people don't have the virus, because it just takes one person to transmit this virus in a congregate setting, and things could just unleash, right? And that's why an interest that I have is working with homeless communities. And I mean, that was the fear we had in Boston for a long time, right? If this virus, goes in the community, homeless community, and these people cannot self-isolate, just like folks living in group home, right? And so we have to test them repeatedly. And so it's something I would definitely think about. I think the nursing homes, I think the policy now is to test them. I think they want to, test them. I can't remember the rate that they were testing them, but to test them definitely more frequently.
Okay, Jean says that, thank you.
I just wanted to jump in on that because in our group home situation right now, we recently found out that the staff it's not mandatory that staff is tested. Now, mostly we're hearing that staff is volunteering to be tested, but we're wondering if we need some guidance around that from EOHHS to say, any staff working in a group home should have mandatory testing.
Yeah, I mean, again, the group homes and the congregate, settings, they pose significant challenges, right? And I mean, all you have to do is look at the nursing home situation to see how bad things can get. And, these group homes, they don't have the luxury to separate people, right? Like they don't have the extra rooms, the extra bathrooms, the extra facilities to do that, right? And so in order to kind of, avoid that, you just have to test. You have to be very proactive in testing, and you might have to test proactively. I know we were trying to set up we had a reentry service that has like a kind of a reentry home in my district, and where people coming from jail and this sort of thing, and they were asking the same questions. And I was like, yeah, we should try to get them tested. And we were able to hook them up. But again, this is why we need to just scale up testing at large. And I hope we're getting there. The numbers are looking more promising, but we still have a lot more to do.
Thank you. Any other questions, you all? Okay, well, I just want to thank you so much, Rep. I want us to help in any way we can on a legislative level. So if there are any bills, I know the House is working on some transparency and data reporting, and there's a little bit of back and forth.
Yeah.
Anything we can do to support those bills, let me know, and we'll get it out, and families will write letters to their reps and senators. And it's just amazing to know that, again, we just have representation at the State House that we can really trust, and we really appreciate that so much.
Well, it's my pleasure to serve you. I mean, I think a lot of us have, called us healthcare heroes, and to be honest with you, it's, this is a job that I signed up for. I decided to run for office. I decided to go to medical school. So this is just me doing my duty. And I think if I could serve and be helpful, well, then so be it. So thank you for all what you're doing and for the work that the ARC's doing, and please be in touch, and we'll definitely see you at the State House when things open up. Okay.
Yes, we will. All right. Enjoy the sunshine today, and we'll just keep going.
Will do. All right. See you guys.
Thank you.
Thank you.
Okay, guys. Sorry, I just gush away around that man because we're so lucky to have him. But I know we're kind of going over, so I just wanted to quickly go through. I don't know if anybody else is experiencing quarantine fatigue. I know that typically means like we can't stay in anymore, but this is what our fatigue looks like. We're doing takeout like 3 times a week now. And sleep cycles are even more messed up because of these long days. And so lots of napping and anxiety and behaviors and the whole thing. So that's our update. And Carrie and I and the team at the ARC was able to begin to review some of the data that came in from our focus group last week. So I just plucked out the group home data related to families who were sharing their experience of having someone currently in a group home. And we were just talking about that in terms of, testing, the isolation that happens. We were able to pull the data together, and basically the 3 big issues are: when can we see our loved ones, and how can these group homes be more flexible while remaining safe, and how can we have enough PPE to see our loved ones again? And that came through loud and clear. Also, what came through was, why aren't all staff required to be tested? As the rep was talking about, this is such a huge way of transmission, and kind of the irony that families can't come in and visit, yet staff can go in and out and not be tested. So those are 2 areas that the ARC is going to really be advocating for, that group homes really begin to think about the emotional needs of the individuals at this really long stretch, the emotional needs of the family, and how they can be flexible while being safe, and still us continue to push the need for mandatory testing of staff. So stay tuned. We'll have a lot more coming out, and probably ways for everyone to get involved, and we'll get the next focus groups analyzed as well. Now, I do have a lot of state updates, so if anybody needs to go, feel free. But I just, and the rep touched on some of this, but the overall trends obviously are showing a decrease with certain outlier days. But sadly, the deaths in our community have grown. So usually Rep. Cutler puts out his data from DDS group homes on Fridays. So I still have last week's number, which is 57, but the ARC will post the new number after he releases that. The governor said yesterday that, we've had 60 days of sacrifice, and so we must remain vigilant. And I think that that's so true to all of our families. We truly are sacrificing, and, just all that our loved ones and our families are going through, it's just even more important that we remain vigilant. So also the Committee on Education met yesterday. It was an invitation-only hearing on remote learning. And the ARC was able to weigh in using some of our focus group information, which is great. And so we'll have kind of the results of that hearing and where the advocacy will go really soon. but it's good that the State House is taking on these issues they're hearing from a range of the community. But special education was pretty big on this topic. So the legislature is also working on a data reporting bill and follow up with me. That's the one I was talking to the rep about. We want to make sure that there's transparency in reporting from congregate care and long-term facilities. And there's a little bit of back and forth at the State House around getting this bill done. I talked to Leo right before this presentation about Mass Health and DayHab payment concerns, and Mass Health payment concerns for DayHab is off the table. That was an error in communication, and Mass Health is paying at 100%, which is great. We're still struggling a little bit around community day and support payments. So these are not at 100%, and they do jeopardize the ability for these day programs to stay whole. So this is probably an area that we will ask for your help in terms of action. Some more updates. The Reopen Advisory Board does not have disability representation, or not enough. So again, I left the link in this PowerPoint for anyone to, if you haven't already weighed in on some of your own thoughts around reopening and the disability community, go ahead and do that for sure. The ARC is weighed in. We're working on a letter now to get in before the deadline. The medication rationing, I wanted to bring up a little bit with the rep because we do know that, as he mentioned, there's been improvements with remdesivir. So it brings up the whole issue of rationing again. So if there's not enough medication, as we find that these medications are working, how do these decisions get made around who gets the medication, who gets the vaccines? So it's really important that we stay super active around the healthcare discrimination that we've clearly faced in the disability community. Also, still looking for accommodations in hospitals. It was great to hear Dr. Santiago talk about making a sound decision around letting families support their loved one in a hospital who has a disability, but we are still hoping for some state guidance on that. We are out of the surge, but that doesn't mean that, you know, we're not going to face this again at some point. And lastly, on the healthcare update, we are working with the original coalition that worked on the crisis standards of care to do some hospital training and education in collaboration with the Mass Hospital Association. So we feel really good about that. Now's the time to jump in and put together some trainings on why these disparities should not be happening and how we can affect that. So that's all good news. And so once again, join Ellen tomorrow. I won't keep you guys, but a really, really important update tomorrow because the fourth package is out. And we really need advocacy for the disability community, basically for home and community-based services, for PPE, for direct support, and for paid leave for all, and for those economic impact checks to be across the board as well. We wish there was a few more things in package 4, but we're not going to give up on those things. But we do need to get what is in there through. So listen to Ellen if you can, otherwise go to the ARC US and you can get an update there. So what do I have? Oh, I would definitely take some questions, but I just wanted to say that I know a lot of you know that I'm an avid yogi, and I think a lot about the lotus in the mud, which is kind of an iconic yoga story. And the lotus flower blooms in the muddiest of conditions, and it roots in that yucky mud, but it blooms really clear, and it blooms really clean, and it's really strong because of that mud that it roots in. And I just keep thinking about that. We're in the mud, we really are, but we're going to be stronger, and we're going to have a chance to all bloom. And so I'm so grateful that everybody's, you know, in this together, and And I look forward to, you know, staying together through this whole thing. So any questions, you guys, before we close out? I don't know if Carrie left already. I'll stop share and look at my chat. Oh, lots of questions. Okay, let me scoot to the top. Isn't Rep Santiago wonderful? I'm so glad we had him. Okay, I'm gonna go back to Cindy in a minute. Why does the DDS data, Chris says, only get released through the legislature? Exactly. I don't know the answer to that, Christy. We're really confused by why only Rep Cutler seems to be able to get this information, and we've been asking that exact question directly to DDS without a really good answer. Yeah, and so right now we're just gonna take it from Rep Cutler and take what we can get. Did I miss anyone else's question? Go ahead and unmute if I did. I don't think so. Okay, well, thank you everybody for coming, and I hope to see you next week, and stay well and stay strong and stay safe.
You too.
Thank you.
Bye.
Bye, everyone. Thank you. I guess I can. I'm so goofy with my